It's now my distinct pleasure to call up to the front our supervisors from the 1st and 2nd District, respectively, the Chair of the Board of Supervisors, Supervisor Matt LeVere, and Supervisor Jeff Gorell for some opening remarks.
Well, good evening, everyone, and thank you so much for being here. Supervisor Gorell and I were talking in the spring about issues that he and I could work on together, and one of the things we learned in those conversations was the shared concern we had for the devastating impacts that fentanyl is having in our community. And those conversations continued on and really resulted in tonight, because what we believed was that everything we were learning needed to be shared with the community. And so I know how busy all of you are, so thank you for taking time out of your busy lives to come here, to educate yourself, to hear from subject matter experts, and hopefully to learn how you can join us in this community-wide fight against fentanyl. So thank you for being here.
Yeah, I'd like to echo the chairman and just say, first of all, welcome to the 2nd District, Supervisorial District. You're in the 2nd District here. And these beautiful gathering spaces of the Ventura County Office of Education. I am so honored and thrilled and privileged to live in a community and to serve in a community that comes together like this over the issues of the day. And nothing could be more important than addressing head-on the scourge of fentanyl. But it's not just our law enforcement, it's every corner of the community, our educators, our public safety, our public health professionals, our social workers, our youth advocates, our health advocates that are here. Everyone has come together to unite, to lean forward in a way that I challenge you to find any other county, any other community that is this forward leaning. And it's because of the leaders that you're going to hear from tonight on our panel. And it's because of all of you here tonight taking time out of your schedule to help us stand up against fentanyl. Thank you very much.
Thank you.
Thank you, gentlemen. And now I'd like to invite you all to direct your attention to the screen for a short video presentation and a welcome from our host tonight, the County Office of Education.
Good evening. I'm Dr. Cesar Morales, Ventura County Superintendent of Schools. I'm currently in Washington, D.C. and unable to join you in person, but I wanted to take the opportunity to welcome you to this important town hall on the dangers of opioids and illicit fentanyl. At the Ventura County Office of Education, nothing is more important than the well-being of our students. That's why I'm proud that we were able to host our county partners from behavioral health, public health, the district attorney's office, the sheriff's office, and the medical examiner's office. They will be sharing information to help in your roles as parents, educators, and concerned community members. I encourage you to visit the resource tables in the back of the room and take materials home for a review. There are also school resource officers here as well. They'll be available for your questions, along with county staff who can provide additional information and referrals. As with so many challenges our county has faced in the past, we are tackling this one head on. Together, I know we can lessen the dangers these drugs pose to our students, family, and friends. Thank you for being part of the solution by being here tonight.
What we have done in Ventura County is a model for other counties, not just in California, but throughout the nation. We are collaborative in nature. We understand that we have to attack supply, but we also need to address demand. This is a multidimensional, multifaceted problem. It warrants a collaborative and strong response.
I guess with regard to the fentanyl, the increase in fentanyl in Ventura, we really expected it at some point. We saw it on the East Coast. It was much like COVID-19, kind of started on the East Coast, and then you kind of make preparations and try to be ready for it. But really nobody can be ready for what fentanyl is. And it's such a potent drug that compared to things like heroin, it's going to cause more deaths just because it is so toxic, and such a small amount can cause an overdose.
We have been dealing with opioids in some form or another for the last 20 years. Obviously, fentanyl is the next iteration of that, a very highly potent drug that doesn't require a season to make. It's all chemically based, and unfortunately, it's just killing way too many people, and we need to do something more than we're doing.
I think it's important to be realistic and honest about drugs and the problems that they have. You know, the drugs today are very different than the ones that we remember, and fentanyl has really changed everything.
I can't imagine that one of my children would use illicit drugs, and yet the statistics show us that some of our children are using these drugs, and this can be a problem to kids as young as grammar school who are handed a drug by an older child that they admire and urge to just try this. So to the degree that we can get more of these naloxone kits universally in all of the schools, grammar schools, middle schools, and high schools throughout our county, this would be a tremendous addition to saving lives.
Take advantage of the time you have with your children to educate them on the dangers of drugs. Don't assume that they know everything there is to know about drugs, or don't assume that somebody else is teaching them about it. Take ownership, talk to your children oftentimes about the dangers of narcotic use, experimentation, or even taking something at a party that they think is safe when in fact it may not be. I think that biggest role that parents can play is the education at home and reminding their children how dangerous drugs are.
The biggest thing is the response of Ventura. And I talk to my colleagues in other parts of the country where the medical examiner's offices, the coroner's offices are being overwhelmed by cases. There's too many overdose deaths for their office to handle caseload. And so the thing that's great about Ventura that I think is that we're well supported. So we need extra staff, we need extra testing so that we can diagnose the overdoses and then try to get the results out quickly to all of the other agencies within the county.
There has been a lot of enthusiasm, a lot of effort, and a lot of work put into this problem.
The thing that gives me hope about where we're at is the collaboration between departments in Ventura County. We all share the same vision, which is to end accidental opioid overdoses.
It's the partnership and it's the exchange of information within the entities that are a part of this partnership that make Coast, that make Ventura County so unique and special.
He was my son's best friend.
I saw her every day.
Gone, just like that.
She was given a pill at a party.
He thought it was a perfect sex.
Thought it was her. She was given
I asked my doctor about other pain options.
I posted the link on social media.
I'm checking in more often with the people I know.
I talked to my kids.
I started carrying naloxone right away.
I'm telling everyone I know.
Thank you, everybody, for being here tonight. It's now my pleasure to invite the panelists led by Dr. Loretta Denering up to the stage. Thank you all for making time tonight. As they come on, I want you to know a little bit about Dr. Denering. She serves as the Acting Director for Ventura County Behavioral Health, overseeing a wide array of mental health and substance use disorder programs and services. She brings a wealth of relevant experience to tonight's program. Previously, previous to her current role, she was the Substance Use Services Division Chief for multiple years, and she has also held management and technical positions within LA County, the Department of Public Health, Substance Abuse Prevention and Control, as well as maternal, child, and adolescent health divisions. Please give a warm welcome to Dr. Loretta Denering.
Good evening. Thank you so much for being here tonight. I am thrilled with this turnout, and it's so lovely to see our community show up for something so important. And first, I want to say thank you to all of the leadership in this room who made this possible, with our elected officials, our supervisors here. Thank you again. We have some representatives from our state offices here as well. CEO Dr. Johnson and various department heads, our healthcare agency director, and other heads here to show just how important the county is taking this and how proactive we're being to unite all of our resources to ensure that our community have the information you need to keep your families safe. So as has been mentioned through the video, Ventura County really is viewed statewide and nationally as an innovative leader. So while this is a very serious issue, we are better positioned than most counties and most states, frankly, for the work that we've done over the last 10 years. Some of you may know that in 2012, our behavioral health department formed what was known as the Prescription Drug Work Group to look at the heroin issue. So we have been, monitoring and tracking and collecting data and developing prevention and treatment programs focused on opioid use for many, many years. That said, nothing could prepare anyone for the epidemic that was fentanyl. So we have been taking proactive steps since 2018, once we started to see just how intense the opioid crisis was, by being proactive and applying for a grant through the federal government Department of Justice. And that is what formed what we now call our COAST, our County Opioid Abuse Suppression Task Force. And then we knew it was going to take every single arm of our county to be able to tackle this. And so I'm grateful for all the partners within our agency and with our county who stepped up at that time to execute and really gave us the opportunity to start collecting the meaningful data at our local level and at our state level so that we could get in front of this with targeted interventions. It's also how we started to really expand our overdose prevention programs, really working with the state to get our naloxone supplies really up to where they needed. So we're very grateful that COAST has been the framework and the foundation to bring us all here. Again, with the support of public health, the sheriff's office, our medical examiner, and our district attorney, along with our partners at probation and public defender, and our numerous nonprofits, boots on the ground folks, this has been a county-wide collaboration. And I can't stress that enough because a lot of times people get into the finger pointing. Whose fault is this? How are we gonna solve this? And we all know this is not just a behavioral health issue. It's not just a public health issue. It's not a law enforcement issue. It really does take all of us, as evidenced by our community showing up here today to figure out, what can I do? How can I keep my loved ones safe? And so our goal is for you to leave here tonight having learned some things that you didn't know, having some tools that you can use with your own friends and family and information. And so with that, I would like to introduce our panel for tonight's town hall who are leading the charge on this crisis. So, as our county's top prosecutor, overseeing a $66 million budget and 300 employees, including more than 100 deputy district attorneys, Eric Nasarenko has initiated specialized efforts to prosecute fentanyl-based crimes, analyze untested rape kits, and expand support and services to crime victims, including the creation of the Carmen Ramirez Family Justice Center in Oxnard. Eric has also established a mental health unit within their office, a team of 4 prosecutors with unique training and expertise in civil commitment proceedings and treatment-based opportunities, such as mental health, diversion, and veterans court. He was appointed district attorney in 2021 by the Board of Supervisors when his predecessor retired and was elected by voters in June 2022. Eric Nasarenko. Dr. Christopher Young became Ventura County Chief Medical Examiner in July 2017. His undergraduate training was at Pepperdine University, and he received his medical degree from the University of Texas Medical School in Houston. His postgraduate training in anatomic and clinical pathology took place at the Oregon Health and Science University in Portland, Oregon. He is trained in forensic pathology at the University of Texas Southwestern School of Medicine in Dallas. He served as a forensic pathologist at the Oregon State Medical Examiner's Office for 13 years prior to coming to Ventura County, where he served on the Clackamas County Child Fatality Review Team. As a clinical assistant professor in pathology at Oregon Health and Sciences University, he instructed physician residents and medical students. He maintains board certification through the American Board of Pathology and Anatomic and Forensic Pathology and is licensed to practice medicine in California. Dr. Christopher Young. Rena West is the Division Chief of Substance Use Service at Ventura County Behavioral Health, and she is a licensed clinical social worker and is a skilled behavioral health professional with over 16 years of experience leading substance use disorder and mental health programs. A recent focus has been working to ensure medication for addiction treatment is utilized in jail and accepted in all levels of the SUD continuum. Rena continues to work extensively with community partners to reduce mental health and SUD stigma and to ensure life-saving naloxone and fentanyl test strips are widely distributed and available. She believes that problematic substance use is a systemic community health concern that affects everyone. Chief Wayner West. Dr. Robert Levin has been the Ventura County Public Health Officer for 25 years. As health officer, Dr. Levin has been the Chief Medical Officer overseeing all Ventura County disaster and outbreak-related activities and threats. Dr. Levin received his medical degree from the University of Missouri in Columbia. He completed his pediatric residency at San Francisco General Hospital and at the University of California, San Francisco. He is board certified in pediatrics and pediatric infectious diseases. In 1987, he moved his family to Chicago, Illinois to become the program director for the pediatric residency program at Christ Hospital in Oak Lawn, Illinois, and then chairman of the Department of Pediatrics at Mount Sinai Hospital in Chicago. He came to Ventura County in 1998 to assume his current position as our public health officer. Dr. Levin. And last and certainly not least, Sheriff Jim Fryhoff. He has been a resident of Ventura County since he joined the Ventura County Sheriff's Office in 1990. He was elected sheriff in November 2022 after serving a number of different assignments in the Ventura County Sheriff's Office, including as the adjutant for 2 sitting sheriffs, assistant chief in Thousand Oaks, chief of police of Ojai and area captain for Ojai Valley, and chief of police in Thousand Oaks. He also served as the operations commander for the Detention Services Division, which oversees the Pretrial Detention Center, Todd Road Jail, Court Services Bureau, Juvenile Justice Center, and the East Valley Courthouse and Jail. He believes the current fentanyl crisis is one of the biggest threats he's faced in his career. Sheriff Jim Fryhoff. First question is for our DA, Mr. Nasarenko. You have often said that the term recreational or experimental drugs no longer applies today. Can you explain what you mean by that?
I'd be happy to. I want to begin by thanking the Office of Education for hosting today's town hall. I want to thank Dr. Denering, my fellow panelists, and also I want to acknowledge and recognize those in attendance today who have lost loved ones due to this crisis. Our hearts, our prayers, and our thoughts are with you this evening and each and every day. We grew up, many of us, in a climate wherein recreational drugs could be taken. Specifically, you could go to a party and take a recreational drug. You could experiment with different types of drugs, no more. In 2023, recreational and experimental drugs have to be presumed to contain fentanyl. This deadly synthetic opioid is in each and every street drug, as well as illicit pharmaceuticals. So when an individual is going through final exams and they want to get an Adderall online, tell them not to. It can kill them. If somebody is recovering from a major surgery and they want to seek an OxyContin or hydrocodone online, tell them not to, because one pill will indeed kill. So this notion of experimental and recreational drugs is something that we have to accept can no longer be part of our culture. Because that line at a party, that pill at a function can end up being your very last breath.
Thank you. And fentanyl has been a game changer and one that has greatly impacted law enforcement. Your office has been successful with regards to prosecuting drug dealers in our county. Can you share your most recent successes?
I'd be happy to. We work in collaboration with VC Focus, our sheriff partners, the DEA, the FBI, and municipal law enforcement agencies. I want to tell you about two arrests as well as convictions, one of which involved a drug delivery network operating out of an auto body shop. Through a very careful and well-planned warrant, 2,800 fentanyl-laced pills were recovered, as well as cocaine, heroin, and methamphetamine. In addition, the 5 suspects had 7 different firearms. Our office charged them with 25 counts. 2 of those defendants have already pled guilty. 3 are awaiting trial. But this is how the Sheriff's Department, law enforcement, and the DA's office work together to both interdict and to stop this deadly poison from coming into Ventura County. There was another incident wherein an individual secreted heroin-based fentanyl in our jail. He furnished that heroin-based fentanyl to another individual who nearly died. We charged and successfully prosecuted the individual who furnished the drugs in jail, and he is now receiving a 10-year prison commitment. We have to be aggressive, thorough, comprehensive, and make sure that traffickers and those who sell this deadly poison in Ventura County understand if they do so in our jurisdiction, they will be prosecuted to the full extent of the law.
Thank you, DA Nasarenko. So the next question is for Dr. Young. It's known that your office, the Office of the Medical Examiner, currently sees 1 overdose death from opioids or fentanyl every single day. In the 20 years that you've been a medical examiner, can you tell us how your job has been impacted in the last few years when it comes to overdose deaths?
Certainly. So I've been practicing forensic pathology for around 20 years. And my career just happens to overlap with the opioid epidemic. So when I was in medical school, we were being trained to prescribe a long-acting and a short-acting opiate to make sure people didn't feel any pain. And so that was the beginning of what we're facing now. But this has been a changing, evolving epidemic. So at the very beginning, because of the prescription practices and people becoming addicted to opiates, it was very much a drug-seeking and diverted prescription drug problem in our country. And so after the first decade of practicing forensic pathology and seeing mostly that type of overdose, heroin became a big part of it too. So when I was working for 13 years up in Oregon, we were seeing a lot of heroin and a lot of prescription drugs and a combination of that. And the heroin was coming up the I-5 corridor from Mexico and being distributed along the West Coast. When I first came to Ventura in 2017, it was much of the same. So we had very commonly had heroin overdoses, lots of benzodiazepines mixed in, but heroin and prescription drugs was the problem. In 2020, something changed. We were looking at the pandemic, but we noticed we were starting to see fentanyl. We had seen fentanyl before. We had seen people abusing patches, using diverted drug, and sometimes a rare illegal form of fentanyl would come across our shop. But in 2020, something changed and fentanyl came to our county. The numbers skyrocketed. And so it's unlike anything I've seen in my career. I would go to conferences and hear about counterfeit pills. You would hear about all of the deaths wiping out entire communities on the East Coast. So we knew there was a good chance this was coming, but it finally did come here the second half of 2020. And just to give you an idea of how the numbers changed between 2016, when it was prescription drug and heroin, we had 116 total overdoses, and in 2022, 278. So that's an increase of 140% just between those years. And then when you look at 2016, about half of those overdoses were opioids. So heroin and prescription drugs were here, but it wasn't a lot of fentanyl, only 8. That was 15% of those overdoses, opioid overdoses, were fentanyl. That's a very small number, and there were 20 heroin that year. And so then if you jump to 2022, 278 total overdoses. Of those, 181 were fentanyl. So that's 116 total overdoses in 2016, and now 181 just fentanyl in 2022. So that just kind of shows you how the size of this problem and how terrible it is. And heroin really has gone away. So some people think that, well, it's prescribing, it's these prescription drugs that are falling into the wrong hands. There's a lot of talk about fentanyl pills. These pills are counterfeit pills. The fentanyl that is killing people right now is illicit forms of fentanyl. This is not a prescribed drug that somebody's getting their hands on. And they're making it look like different things. I call it the great imitator, but the numbers are staggering.
Yeah, those are staggering statistics. And to that, there are a lot of misconceptions about who exactly is dying from fentanyl overdoses. Can you tell us about the people you were seeing who were dying, who were coming through?
So it could be anybody. There's a misperception that this is a homeless problem, that it's homeless people, that unhoused people that are using drugs. And there's this stigma, but it is all socioeconomic levels, and it's all ages. In 2022, it was less than 30% of the overdoses were homeless individuals. So these are people that many times have jobs, homes, people in our community. It's eye-opening, seeing them die, and we do a thorough investigation and learn a lot about their backgrounds and how they became addicted. And but the majority of people fall in the ages of 31 to 50. Out of the 181 fentanyl deaths, there were 102 that fit those age categories.
Thank you. And that leads us to the next question that has to do with prevention and treatment, and what exactly does that mean? So for Chief West, you've worked in substance use and prevention profession for 16 years. When we hear the terms substance use disorder and opioid use disorder, can you tell us what exactly that means?
Yeah, sure. Kind of like what Dr. Young said, anyone can get a substance use disorder. So a substance use disorder is it's a brain disorder that one would get after prolonged use of a substance. It involves a variety of symptoms, and it's listed in the DSM-5, like other mental health disorders. The symptoms are, there's 11 of them, and if you have 2 to 3 symptoms, that's a mild substance use disorder. If you have 4 or 5, that's a moderate, and over 6 is a severe substance use disorder. And so they're put in different categories. So there's behavior symptoms that there's 3 different ones. And the first one is control and impaired control. So somebody will take more substances than they plan to, or they'll try to quit and they can't. There's also a section for social problems. So they'll use enough substances that it causes problems with their family, problems with work, or problems with school. And then there's also a category for risky use. So somebody might use substances in a risky situation, such as driving a car or operating machinery. And then also they'll still use, even if it creates problems with their physical problems or mental health problems. So those are kind of the behavior parts of a substance use disorder. And then there's 2 physiological symptoms, and those are tolerance, which somebody would take more of a drug in order to get the same effect. And then also withdrawal, which means if you stop using it, then you become really sick. And that's really the part that's pretty specific to someone with an opioid use disorder. There's other use disorders that will also have withdrawal as part of their diagnosis, like an alcohol use disorder or a benzodiazepine use disorder. Benzodiazepines are prescribed for anxiety, like Ativan or Valium. But for an opioid use disorder, the withdrawal symptoms are so bad that that's why people continue to use. So generally somebody will start using an opioid for the high or for the effect of it or to alleviate other symptoms of depression or pain, but they end up continuing to use it so that they don't go into these really, really severe withdrawal symptoms. So that's really what we're looking at when we look at people who have an opioid use disorder. They're trying to keep from having this terrible sickness that impairs all of their functioning.
So when we talk about, the treatment options that exist, I think a lot of folks are familiar with counseling and therapy, but with opioids, we have to tackle that in a little bit different of a way, in addition to the counseling and the therapeutic aspects. And so in our field, we use what are called medications for addiction treatment. What do you say to those who question whether MAT, as it's known, is actually helping someone who's addicted to opioids?
Yeah, thank you. Good question. So what I would say is that medications for opioid use disorder is really the gold standard, and it's something that saves lives. It also changes lives and helps people get better. So when I was talking about withdrawal symptoms, it's like someone can take any opioid to feel better. Medication for an opioid use disorder is a type of an opioid that someone would get prescribed from their doctor, or it would get dispensed from a narcotic treatments program. Those include the older ones would be methadone. That's something that's dispensed at a narcotic treatment program. But there's buprenorphine, which is a newer field of medication, which acts like a regular opioid, but it's only a partial opioid. So it will bind to an opioid receptor in a person's brain, but it'll just partially bind. So it only partially affects someone. So it'll curb the craving, it'll get someone out of a withdrawal, but it has a ceiling, so they won't be able to overdose from it, and they also won't be able to get high from it. And a neat medication that's really popular is Suboxone, which is buprenorphine cut with naloxone. So somebody would take a Suboxone, which would alleviate their cravings, alleviate their withdrawal. But if they try to use another opioid, like heroin or fentanyl or another one, they're not going to get high from that. So they're not going to want to do those. So it's very safe. And the difference between a medication for addiction treatment is it's prescribed by doctors, it's monitored by doctors, and it's not given to you by a drug dealer, right? So it's very safe and it's very effective. The other thing that you can do with medications for opioid use disorders is control the use. So you can work with a doctor and taper down. You can, have less amounts, and it gives a person a period of time away from the dangerous use. So if somebody is with an active opioid use disorder and they're able to start medications for addiction treatment for opioid use disorders, then they'll be able to take the medication in the morning and still go to work, go to school, live a life that's fulfilling and healthy. And then as they do that, they'll get further and further away from the people that they used with that were dangerous. They'll get away from the people that they knew that used drugs, that they used with, that they bought drugs from. And then eventually they can work with their doctor, taper down, stop using it, and find themselves completely substance-free and living a healthy, happy life.
Thank you, Chief West. Dr. Levin, as the public health officer, you have been the voice that Ventura County has listened to regarding health emergencies for the past 25 years. What makes the fentanyl crisis unique?
First, I want to address the way that it's not unique, and that's that it follows a series of drug crises: heroin, OxyContin, Vicodin, and what they all have in common is human weakness, our nature. Okay. And that nature is fueled by the profit motive. Second, an extremely small amount of fentanyl can kill you. A few grains, like a few grains of salt, what appears to be a few grains of salt, is enough to kill people. Third, when you're taking an illicit drug, some other illicit drug, you don't know that it hasn't been laced with fentanyl, and that happens all the time. Fourth, if you take fentanyl and then something else like alcohol or a benzodiazepine, which is a Valium, or a Xanax, it can intensify the effects and make it more likely for you to overdose. And then fifth, it used to be that people would have a long relationship with drugs of abuse like heroin. And you could be a heroin addict for decades. Now we're seeing people take fentanyl and die after their first dose.
Sheriff Freihoff, when you came on board as sheriff in January 2023, one of the first things you did was create VC Focus. Please tell us about that, what it stands for, and what you created it for.
Well, thank you very much. The Fentanyl Overdose Crimes Units, which is what FOCUS stands for, was done with great intent. We are facing a challenge that is not like any other challenge we've ever seen. The narcotic that people are using right now is the most deadly narcotic to this point. It seems like every time we get over a hurdle with one, a more dangerous one arrives. Not just the sheriff's jurisdictions are dealing with this, but every jurisdiction in Ventura County, and certainly countrywide. But within our county, we wanted to really put our team back together like we had during the opioid epidemic and get back to working with task forces. It's been very difficult. I'm not the only agency that's struggling to hire law enforcement officers. We're short. If anybody's interested in applying, we're hiring. And every agency is facing a shortage. And we're all chasing the same problem. And so by us working together, it's a great use of our resources. It's a great way to be focused on the problem here in Ventura County. And make no mistake of where this is coming from. This is 100% a cartel-driven activity. The New Jalisco Generation Cartel and the Sinaloa Cartel are responsible for sending this poison to our country. They are getting the illicit ingredients from China in large quantity. They no longer have to worry about growing fields. They don't have to worry about harvesting fields. This is a synthetic opioid that they can make in pressed pills 24 hours a day, 7 days a week, 365 days a year. And it's very profitable. And they do not care about you. They don't care about your family or your friends. They are in it for the money, and that's it. So I have a friend here whose son died of a fentanyl overdose. I am not going to forget that. I have a team here that is working on it very diligently with all the other agencies, and not just our local partners. We have federal partners. We have the FBI, the DEA, Homeland Security. I think the only federal partner we don't have, and that's the Marshal's Office, and I gave them a very compelling reason why they should be joining us too. This is a problem for all of us. And it starts with enforcement and letting people know that we're not going to let it go by. Education like Coast is doing to make sure people are aware. But one of the articles that we recently read said only 4 out of 10 parents are talking to their kids about drugs. 4 out of 10. It should be 10 out of 10. And the grandparents should be talking to their kids also. And not one time. How many times did you have to ask your kids to do their dishes before they did the dishes? Was one time enough? Probably not. Talk to them all the time, repeatedly, telling them the dangers of the drugs, what it can do, the damage that it creates potentially permanently, let alone the death that it can create by talking to them about what these dangers are. And so for those that are here, I see pictures up in the audience, obviously, of people who have lost their loved ones. I hear you. We hear you. And pretty soon the people responsible for this are going to hear from all of us.
Thank you, Sheriff. And just to really hit that point, as a parent, what message would you most like to see other parents leave here with tonight?
So for the parents, tell all your friends, your neighbors, your loved ones that, as the DA had mentioned earlier, there is no longer such thing as a recreational drug. Every drug out there now has the potential to have been laced with fentanyl. If you are not getting it from a pharmacy in the United States of America, there is a good chance that the pill you're taking is laced with fentanyl. There was an alert that came out, I believe it was either Orange County or Los Angeles, that gave a warning to people who were going to Mexico to go to pharmacies to save money on their pharmaceutical drugs. And the pills there have fentanyl in it and not the actual narcotic, because they don't have the same requirement that we do for what is prescribed to folks. So tell your kids, tell your grandchildren about the dangers of drugs, and do it repeatedly so they have an understanding of this one pill can kill. The idea that you could try it once and see is over. This is a huge problem for not just this county, but for our country. We need to do a demand reduction where we educate people so they don't take it. And then we're going to go after the supply folks who are dealing the drugs. And as the DA had mentioned earlier, if somebody dies, we are going to prosecute them with murder. We are going to go aggressively after these folks, because that is what we're here to do. I'm very thankful to have such a strong supporter in our DA, Eric Nazarenko, to work on this problem together. Thank you.
Thank you, Sheriff. And now we're going to take some of our questions from our community here. And the first question is, what does fentanyl actually look like? And what are the different types of use, different types of ways people can use it? Doctor.
I'll tackle part of that. So it really can look like anything. It comes in a powder form typically, but it's being pressed into pills that look like a prescription pill. It can go and make it liquefied, and they can put it into other items. You can smoke it, you can inject it, you can drink it. It just is so dangerous in all those ways. And obviously for a while you saw it was being marketed to look like Skittles and marketing it towards kids. We did have at least one case here locally where that was a case where we did an arrest where we caught somebody with the fentanyl pills that looked like Skittles. So it is a very malleable drug that can be used in a number of ways.
And with regard to that, when we see somebody die of an overdose from fentanyl, a very common scenario is a burnt piece of foil and a straw. And the scene where somebody dies is very telling, because oftentimes the person has the straw in their hand still, they're clutching a lighter, and it shows how quickly this drug kills people, because it's as if they just smoked the fentanyl and they collapse right on the piece of foil. And this is very different from heroin, from other opioids, where there's a progressive, prolonged respiratory depression, and the person could die over a matter of hours. These individuals are dying extremely rapidly because of how potent this drug is.
Put in your mind a penny and see Abraham Lincoln's head on that penny. That's the amount of fentanyl on Lincoln's head that can kill somebody. Similarly, what you saw in the slides, take the tip of a pencil. That is the amount of fentanyl as well that can kill somebody. It is odorless. It is colorless. It can be taken intravenously. It can be snorted. It can be swallowed. In each and every method, it is deadly.
Thank you for that. So the next question is about who's most impacted by the use of fentanyl. So in comparison to deaths across the county, about what percentage are caused from fentanyl overdoses? And then the second part of that question is wanting to know which communities or which populations are most impacted. We know that this impacts everyone, but who are the most impacted, and what steps are being taken to provide favorable outcomes for those who are most impacted?
I'll tackle that. The number of deaths that we see in Ventura annually is somewhere around 6,000 to 7,000. And so for 2022, we had nearly 300 overdoses, and of those, 181 were fentanyl. So that's too many. Historically, my office would deal more with natural deaths. That would be the manner of death that was most common. But now accidental deaths outnumber all other manners. And that's because of the combination of overdoses, because of the opiate epidemic mixed with motor vehicle accidents. And we, in fact, have more overdoses now than motor vehicle accidents.
Thank you. And Chief West, can you tackle the second part of that question about what steps are being taken
The steps that are being taken for
for the populations who are most at risk?
or most at risk. Well, we're doing things like a lot of outreach and education and really getting into the communities that people most use in, really looking at encampments and focusing on people who are unhoused and also people who use stimulants, because stimulants, even though I talked earlier about opioid withdrawal, it's really found in about a third of the stimulants. So cocaine, methamphetamine, and even club drugs like MDMA and ketamine. But there's a table in the back that has lots of information about the work that we do. And so definitely go and visit that, and that'll show you, where we're at and what we're doing.
I'd like to add that in the United States, in people under 50 years of age, drug overdose is the biggest killer. It's a bigger killer than heart disease, cancer, suicide, accidents. It's the number one killer under 50 years of age.
And for the sheriff's office, we see overdoses in every single one of our areas that we patrol. And although what you're hearing up here about is the number of deaths, the number of accidental overdoses where people were saved is quadruple that, at least. Had we not had naloxone and all of our deputies carry it, the number of deaths you'd be hearing about tonight would be fivefold, at least. And I've seen when I get my notification of what's occurred throughout the day, we had one individual who used in the morning and was resuscitated. Used in the afternoon and was resuscitated. Used again in the evening and died. So that goes down as one death, but there were 3 times that person used and before they died. And we're seeing this everywhere in our county. There's no place that's safe. This is occurring in every single community in Ventura County. And it doesn't know who you are, it doesn't care. If you take it, there's a good chance you're gonna die. The pills that have been coming across the border in 2022, they said the DEA did a study and there was 4 out of 10 of those pills had a lethal dose. This last year, 6 out of 10. So if you could imagine a bowl of M&Ms in front of you right now, and I told you that one of those M&Ms could kill you, but I'm not going to tell you which one it is. How many M&Ms are you going to have? That's what we're up against.
Thank you, Sheriff. And the next question is
Could I add one more thing to that?
Sure.
I'm sorry.
That's okay, Dr. Lynn.
And that is that a number of different sources are giving out fentanyl in our county. The health department has given out fentanyl as well. And just last year, we gave out 462 doses that were used on people to reverse overdoses. 462 times. Those all could have been deaths.
He's giving out naloxone, not fentanyl.
Not fentanyl.
I promise you.
Forgive me.
Otherwise, he's going to come with me after this.
That's a lot of naloxone.
Yeah. Okay, and just really quickly to follow up on that last part, Sheriff, and then the next question is for everyone as well. But what barriers specifically are the Sheriff's Department facing in fighting these crises across the county? And for everyone, what can the community do to help?
Well, fortunately, we have a very supportive Board of Supervisors who understands the importance of this for our community. One of the challenges that we had been facing was a lack of scientists to be able to test the drugs so we could prosecute those because it has to go through a full testing process. And we've been awarded additional scientists to start working on the backlog of our cases for our dry drugs, including fentanyl. We have our focus teams that we're funded for, that we've been able to do pivot and partner with all the other law enforcement agencies in the county. And having that support allows us to be aggressive in our efforts to go after the people who are dealing. Where we could benefit from the community is helping pass on the education and the materials that the Behavioral Health Department has put together so that you can quickly talk to your friends and family about the dangers of fentanyl and what it is. You know, what I was talking about, the Just Say No campaign wasn't super effective, but it gave a very quick way for parents to talk to their kids that they felt comfortable saying, well, just say no. Because certainly just saying no is easier than saying never again. Because once you're an addict, you really have to say never again. And that was the part of the Just Say No campaign that was missing. The biggest difference now is when people are using drugs now, it will kill you. They weren't facing the same crisis then. And so the more you can educate your friends, your neighbors, your family, use your social media, go on to the behavioral health website and share that information saying, hey, we attended a conference. This is what was shared with us. Please read this. These are the 5 takeaways. You should all have cards that kind of have like what the 5 issues of fentanyl are that can help really narrow down how you can educate your friends and family about this and the dangers of drugs.
I want to piggyback on what our sheriff just mentioned. We have a board of supervisors and a CEO who gets this. Just a couple days ago, they appropriated opioid settlement funds as well as general funds to create a fentanyl-based prosecutor to give the sheriff assistance in his crime lab so that we could test for this synthetic opioid, to support Dr. Young with an additional senior investigator, to support the public defender's office in their outreach campaign. When people are released from jail, they have successful reentry options. We also have for Chief West opportunities now, thanks to this board and our CEO, for substance use treatment and intervention. So this is critical. But I want you all to know that there is a bill right now that is on the governor's desk, and he needs to sign it. It's AB 701, 701. This would allow us as prosecutors to add what is known as a weight enhancement or an additional punishment for those who traffic in kilos of this deadly poison. We have this weight enhancement, this additional punishment for cocaine, methamphetamine, and heroin. We need to add it through the governor's pen to fentanyl as well. Please urge Governor Newsom to sign AB 701.
Thank you, DA Nasarenko. And let's turn a little bit to treatment and access. The question is, why is it so easy to get dangerous drugs and so hard to get the MAT you just talked about? Can I get it from my regular doctor?
Yeah, you can get it from your regular doctor. And that's the great thing about MAT now is there's been a lot of, well, initially you had to have a certain license in order to prescribe it, and that's been lifted. So any person that's got a medical doctorate degree and is able to prescribe any other medication for any other health issue can also prescribe medications for addiction treatment. We also have it at VCBH, so you can come to our clinics and get it prescribed by Dr. Velasquez's team, who's right here. And then we've got all wonderful doctors at the Addiction Medicine Clinic that will also prescribe it. You can get it at the 5 narcotic treatment programs that are in the county. So it's really available, and I think just asking for it is a great step, and then, you know, calling our access line and we can help you get it that way too.
Can I piggyback on that too?
Absolutely.
So we recently worked with Coast to present and teach physicians to feel comfortable prescribing these drugs to help with MAT. And so it used to be that addiction clinics would handle most of people who are addicted to meds, but this is bigger. This is a bigger problem than the addiction clinics can handle. There's not enough clinics, there's not enough doctors. So the doctors who are your family practice doctors, your psychiatrists, they need to be prescribing these drugs and helping with this problem. This is all hands on deck. And it was really nice to have those doctors at a convention to speak to them and have the experts who treat addiction make them feel comfortable facing this problem too. And so that's another way our county is reaching out and addressing this problem.
Thank you, Dr. Young. And another question, aimed at treatment access and recovery is needing to know how to find recovery services that are covered by the state, so using Medi-Cal insurance. Chief West, can you talk about the expansion of Medi-Cal and what this means and how folks can access these services locally in county?
Yeah, absolutely. So it used to be if you had Medi-Cal, you couldn't really use it for substance use disorder treatment. It was very difficult, and it only covered a few things like group counseling, and you really couldn't even get any residential treatment unless you were pregnant or had a baby. So what's changed is that they've expanded it so that Medi-Cal covers the array of treatment options. And in 2018, Ventura County opted into a drug Medi-Cal organized delivery system, which is a state-funded program that covers all of the services. So you can get group counseling, but also individual counseling. You can get medications for addiction treatment and other narcotic treatment medications. You can also get residential treatment now. So Medi-Cal will pay for residential treatment and withdrawal management, otherwise known as detox. So just by calling the access line at VCBH, a person can get screened and then connected to any type of treatment for their substance use disorder that they need. So it's really been a game changer, adding all those different services, and there's no barriers to accessing substance use disorder treatment anymore if you have Medi-Cal insurance.
Thank you for that. And, you know, along those lines, people want to know, because this is so deadly and so serious, and we've been talking about just how one instance can be so tragic. There's a question as to why can't someone go to mandatory rehab if they can die?
Well, because it's a disorder, it's a brain disorder, it's a medical issue. So just like you couldn't demand that somebody go and get diabetes treatment or, you know, heart disease treatment, it's medically necessary, and it's voluntary. Does that answer that? Yeah, you can't mandate it, but you can definitely encourage, you can educate, you can help, and that's part of what we do, is really just try to engage folks into treatment, and part of our job is making treatment something that people want to come to, and that's what we're working on and what we're using some of those opioid settlement dollars for.
Thank you for that. Okay, and one of the questions is noting that we are here at the Ventura County Office of Education, and that prevention is one tool that we can use to help keep young people away from drugs. And so folks are asking for increased collaboration with VCOE and all agencies to promote prevention. So what is the strategy for our county in building a robust prevention program for our young people?
Me again, okay. So, well, you know, exactly. We want to start where folks are when they're younger and really get the education to them. And so a strategy is looking at tools that young people want to use. So they're using social media, they're using really high-tech computer systems. And so we want to actually use those types of digital platforms to educate and inform young people about the dangers of all substances, and especially fentanyl. And so we've just recently at VCBH, we've got a new prevention lead for adolescents, and to work with the schools and to really get in and work with the teachers and other education professionals to get the word to the young people in ways that they'll respond, in ways that they'll pay attention. It's not the same as the substance use education of the past. We've got to kind of step up our game and really get to kids how they're going to respond and what they're going to listen to.
And I'll add to that as well. And I know I've talked about this already. Remember, your children's first educator is the parent. Parents have a lot of ownership in this. This isn't just for the schools to do. If you have children, grandchildren, please educate them. The first time they hear about fentanyl should be coming from you, and then reinforced at the school. I know our school resource officers are a resource for our children in our schools. They intentionally have soft uniforms so they're more approachable, so that the kids can talk to them. They're well equipped to be able to talk about the dangers of drugs, so they can ask questions in really an environment that is conducive to that. I know for parents, like I said, if they're not educated on what fentanyl is and how it works, there's a lot of material in the back of the room and certainly on the website that can talk about it. And it's well worth your time to research it so that you can have that conversation with your children about those dangers. And then certainly having the school district follow up, not only our public schools, but our private schools, on what these dangers are, because this is a full court press. This is everybody's job to be talking about this.
Thank you. And for our doctors on the panel, the question is, we've been talking about fentanyl all night and how we saw the shift from heroin and fentanyl. And a lot of parents out there, myself included, are thinking, so what's next? Do we worry that there's something worse out there coming after fentanyl? And how are we positioning ourselves to be able to deal with that in the midst of this?
There is something worse, and it's already appearing on the scene, sometimes by itself, sometimes mixed with fentanyl, called xylazine. It's a veterinary sedative that really doesn't, it's not approved for humans, and there's no human antidote for it. There's veterinary antidotes for it, but doctors don't have those antidotes in the emergency room because it's a veterinary drug. And it does not reverse with naloxone. And so if someone overdoses on the two drugs together, and they can be mixed together, they're seeing this more out on the East Coast, you can give naloxone, Narcan, and you will reverse the fentanyl part of it, but you won't reverse the xylazine part of it. And it's a respiratory depressant, so the person's not breathing.
And I've spoken with my colleagues on the East Coast where they are seeing a lot of xylazine. They call it trank a lot of times, a zombie drug, because it causes necrosis and lesions on the skin. But the good news is that it's not causing overdoses by itself typically. So it's something that's being added to fentanyl. And just because there's a lot of media attention to it, I think it's good because it's making people realize that fentanyl can kill. It's kind of raising the level of awareness. This has been an evolving thing, the opioid epidemic. I mean, it's been changing. So there's always going to be something next, I think. But right now, the big problem we're dealing with is fentanyl. We have had 2 overdoses of xylazine in our county so far. One before, it was well known that was out there, and one more recently. So fortunately, this isn't something that has been affecting the West Coast yet.
And although I'm not a doctor, I'll tell you that we've seen drugs transition and get worse and stronger for the 33 years that I've been in law enforcement. And so I fully expect that pattern will continue. And as we talked about before, this drug is a synthetic drug. Right now, there is somebody trying to figure out how to make it stronger, more potent, potentially more deadly, right now. And unfortunately, because we don't have the chemical makeup of it, I don't know that we're going to be able to come up with an antidote for it right away. And so we have to be prepared and be prepared to see it. And because our doctors are talking to people on the East Coast, if they're the ones seeing it first, then we can learn from them. If we're the ones that see it first, then we'll be making sure to share that information across the country so we can tackle this together. But I fully expect that if we can beat down the fentanyl, we're going to be facing something else next. The problem, once again, is we have cartels who run in Mexico unabated. And they are able to get the precursors to make fentanyl with no problem from China. If we can't find a way to interrupt that supply, we are going to be battling this for a long time in our country.
Thank you for that. And so we want to wrap up on a hopeful note, on a cheerier note. So for all of the panel and the time that we have left, can you share anything about this moment that we're in that gives you hope?
Dr. Levin was before the Board of Supervisors on Tuesday, and he was just spot on about Ventura County. It is right-sized. We're not 10 million, our neighbor to the south. We're not a couple thousand like some small counties in the north. Because we're that 850, we are able to secure and utilize resources. We know one another on a first-name basis. Any of us here can text, call, and reach one another when there's an issue. We don't have turf battles. We don't have political fights. We just have a common objective to save lives. So for those of you in the audience today, leave with this as well as many other thoughts. This county, through the coast effort, will continue to be unrelenting in its focus on fentanyl from a multidisciplinary standpoint: public health, our medical examiner, behavioral health, public defender, our medical officer, the DA office, Sheriff Freihoff, and all of us. When we work together, we work stronger, and we can do a lot to fight this scourge.
And I think what gives all of us hope is seeing all of you out there. Someone was mentioning just before this conference began, an hour ago, that we put on a presentation like this 10, 12 years ago, and a few people came, 3 or 5 people. But look at this group now. So thank you very much for being there for us and for being there for yourselves.
I think from my perspective, the numbers that we see can be very depressing, discouraging, but the efforts that our county are putting forth, I know the numbers would be much higher. So that's the hope I have. And, you know, everything we do together is medical examiner prevention work, and I appreciate all of it.
Also, on those lines, just having everyone together talking about substance use disorders and talking about treatment and talking about our fellow community members and our friends and our family. And it's not a hidden disease. It's not something that we're ashamed of or something that we don't want to talk about. You know, we're removing that stigma, especially in this county, and we're recognizing that it can happen to anyone, and that it's something that we all need to come together as a community to fight. It's not a moral failing. It's not something that happens to someone else. It's us, and it's our friends, and it's our family, and it's our neighbors. Thank you.
And I would just like to echo all of my colleagues. What gives me hope is, you know, the support that we have from our board, our CEO's office, and our agency. I worked in that county, that 10 million county, and I know it takes mountains to get things like this out on the ground. We bring information to our community in meaningful, tangible ways that you can have the tools you need to sit down with your loved ones, have those difficult conversations, and then have the resources there. That gives me hope. With the pace in which this county responds to crises, we are a very resilient county. We have been through a tremendous amount of tragedy and just uncertainty in the last decade. And when we all recognize what was happening here, there was no having to convince our leadership that we needed to take drastic actions. And so again, on behalf of all of my colleagues, we want to thank you all for listening and hearing the needs from the community. From all our offices, we see the day-to-day, the struggle. And we're privileged to have leadership to be able to respond. And with that, I would like to just know that we do hear you, and all these questions that we have will be answered, and we will provide responses online at VenturaCountyLimits.org, and we will send out communications so folks know that their questions will be responded to. Please also visit our resource tables in the back. We have a plethora of information there. You can get your naloxone kits, sign up for trainings, figure out resources for your loved ones and yourself. And again, please, please, please provide us feedback with your surveys that will help us, help our funders know that we're doing exactly what we said we're going to do. And again, thank you for sharing your evening with us, and we look forward to the next event. Thank you.
You don't have to leave. The resource tables are here, but I know a couple of people noted that they'd like to share their story. If you're one of those people, please come on up and talk to Victoria. And we want the faces of fentanyl to emerge from the shadows and take this on, head on. So if you're someone who wants to share your story, please come on up when you feel comfortable. And thank you, everybody, for being here. Please fill out if you want a cookie, no, please fill out your feedback forms. We really need it, and we will apply it to our future meetings. Thank you all for being here.
And thank you, Dan.
Great job.